Today, we're going to be discussing an overview of visual perceptual interventions and how these things can apply to the field of occupational therapy and what's currently used in the research. So, starting off, I just had some objectives. Number one is to understand the subsets and processes of visual perception and which skills are going along with those. Number two, to receive a comprehensive overview of current visual perception interventions. Number three, to identify client populations susceptible to visual perception deficits. Number four, to identify future areas of study regarding visual perception-based interventions. And finally, number five, to connect current visual perception interventions to the field of occupational therapy in a therapeutic way. So first, we'll be discussing some current interventions used based on the research that was found. Among the 6 articles that I found, there was 4 overarching themes of almost subsets of visual perception interventions and different modalities used to deliver them. The first thing that I found was being video game based. So this used different video game platforms to facilitate bilateral hand coordination and hand-eye coordination. In current studies, they have used games such like the Wii, Wii Fit, or Wii Sports. Other consoles such as Xbox or other things with handheld controllers are also being looked into. Number two is computer-based interventions. Many therapists have utilized computer games and programs, such as the picture below, that's an audio-visual program to help improve visual perception. These programs help stimulate different visual skills and can be targeted to a variety of client audiences. For number three, it was a sports-based intervention theme. They looked at the effect of racket sports with sports such as table tennis to be used in therapeutic ways to promote visual motor skills. So below the picture is just an example of that. And then number four was play-based, stating that therapeutic play with items such as Duplo blocks, which is a different name for Legos, or different worksheets with play, help encourage visual tracking and promote saccades with a build pattern that's followed. So this was primarily used in pediatrics, and the majority of research was used in pediatrics, just to note. So starting off with video games for visual perception, there were multiple studies with this, and they used iPad or Wii games to improve visual scanning and figure ground perception, which is the ability of a child to distinguish objects on a background. They also found that they improved executive functions and bilateral hand coordination. As you can see in the pictures with the Wii or the iPad, specifically tasks that involved the use of both hands and the visual system promoted the most progress. Historically, a lot of people have frowned upon video games as being something very negative and detrimental to a child's development, and too much of it in excess can create that. However, there are some studies that are emerging that are saying that we can actually use video games as a therapeutic modality to help strengthen visual perception. Other people have also used them to strengthen language skills, cognitive development, so it's definitely an emerging field in OT. I think that personally it's something that is pretty underutilized currently. There was one study I looked at, which was a level one systematic review, and that utilized Wii Fit. So they used sports, skating, skiing, and more, and they basically trained the children to scan for objects. With, for example, skating or skiing, they had to duck or dodge objects that were in their visual field coming to them on the screen. So this helped promote figure ground perception as well, and it just helped promote the visual awareness and scanning of their visual fields. Also, with handheld controllers, specifically with consoles like the Wii, arm movements actually resulted in an increase in visual perception skills. These boys were aged 7 to 11 years old, and had a diagnosis of developmental coordination disorder, or DCD, and their post tests actually revealed a significant increase in visual skills after they got this intervention of Wii Fit. And since it's a level one, this is pretty statistically significant and sound. The next overarching theme is computer programs for visual perception. With the analysis, it's the use of therapeutic audiovisual programs and computer softwares, which helps patients restore or gain visual perception abilities. You can also customize software. So many of the programs have difficulty levels, and then you can customize those for your client, which really helps promote that just right challenge that OT really tries to integrate. So the picture on the left is a program called 3D Mott. This, you track the blue sphere, and there's different simulations. Sometimes it's rotating, sometimes it's starting to different corners, and this helps visual scanning. It also helps with attention and it delivers auditory cues too, so it combines both the auditory and the visual system. There was one study conducted, a level two, in 2024 that used the 3D MOT with patients who had a brain tumor and then had visual impairment secondary to brain tumors. So with these specific subjects, they had hemianopsia. And the results were that significant results were found with their reading speeds, their binocular vision ability, so their ability to use both eyes, and their visual perception skills. So programs such as the 3D MOT have some good statistical evidence with improving this. Next is sports-based perception. There's also a strong case for racket-based sports and visual perception interventions, which OTs tend to integrate already. Some OTs have used basketball, baseball throwing, but not many I've seen in research have tried to use things with rackets, such as ping pong or tennis. So, a level one RCT tested the impact of table tennis training on visual perception. So, these children had intellectual disabilities, and there were four groups. The one group had only table tennis training, they had it 3 times a week during the specific school block. Group two had traditional OT just with a sensory motor based approach and they worked on visual skills. So, what traditional OT currently does. And then groups three and four were controlled, they just had recess. Groups one and two both improved in the results. However, the surprising thing is that the table tennis group actually scored higher on their post test than the OT group, meaning that table tennis actually was more effective than traditional OT approaches, which was not what the authors were expecting the results to be. The visual motor skill benefits promoted by table tennis was hand-eye coordination, bilateral integration, depth perception, executive functioning, and they also made the case to say that neuroplasticity was involved because there was a strengthening of the visual pathways connected with the rest of the body. And since this was a level one RCT and other studies that I found, these were pretty significantly sound. And it makes the case to say that sports should be more therapeutically utilized in our field. And finally, we have play for visual perception. The use of Dupo blocks, so those Legos or different worksheets requiring the repetition of shapes, patterns, and more, helps improve children's visual scanning. Toys and games are more than just play, they promote therapeutic development, which is a common theme among OT. The picture in the top right corner is a visual scanning chart. So the children practice how fast they can find the items by scanning the different columns. Other emerging data suggest the usefulness of these types of worksheets and games specifically in schools to help visual motor skills. This type of play facilitates visual scanning, sequencing, visual perception, and figure ground perception because they're obviously distinguishing shapes from the backgrounds on these worksheets or toys. There was a study conducted in 2019 that looked at the impact of Lego play on school-aged boys' visual perception abilities. So they followed a build pattern for the Legos, and this was implemented a couple times a week at school. There was actually an increase in visual discrimination, visuomotor, and perception abilities. However, I believe that more research should be conducted with this because this was only a level three quasi-experimental. So compared to the level one RCT, this data is not as statistically sound as some of the other studies. So some further research would be valuable, but I'd say that this has moderate evidence. Here are some potential areas for future research with this topic. So there are some specific skills. There's a lack of research with interventions on just one specific skill, for example, convergence, divergence, etc. So I think it would be beneficial to see something that just hones in on one specific visual skill instead of just listing the few that were impacted, and then you can really know the magnitude of the effects. Also, other age groups was something that was a big theme that was missing. Like I said before, it's mostly pediatrics-based research. There was not much research on visual perception interventions with older adults. I personally would like to see more interventions with this and more research. It's useful to see if these interventions could be helpful for an aging population with degenerative conditions to their vision. Could a experimental group that got a visual perception intervention with declining vision actually experiencing a slowing and the loss of their visual skills as compared to a control who didn't get an intervention? I think that that would be an interesting area to explore. Also, other racket sports such as tennis and research on integrating them into the OT practice would be helpful. The table tennis study just purely had table tennis. It wasn't an OT component. There was an OT group, but the tennis training group themselves only did that. So it would just be helpful to see if OT sessions maybe integrated table tennis or tennis and compare that to a traditional OT group and see the difference if you mix those two factors together. And then other populations, there weren't as much research with children who had learning disabilities, such as dyslexia, so more of that cognitive component. It was just more visual motor based disabilities. Application to OT. These are some top candidates for OT with visual perception interventions. Common themes among the research was that these subjects had conditions such as cerebral palsy, learning disabilities, Down syndrome, developmental disabilities, intellectual disabilities, DCD, hemianopia, or other visual deficits, like with the brain tumors before that I mentioned, TBI, CVA, and different degrees of brain tumors. So, what OTs can utilize? Functional play with shapes and toys or worksheets, mimicking shapes and build patterns, or copying guides off board helps promote the kids' visual tracking and visual memory. This is really useful if you're in the school setting and you have access to these toys or a whiteboard that they can copy down from. This also helps promote school skills as well, especially with saccades looking up at the board and then looking down at your notes. Also, with therapeutic sports, promoting activities with rackets like ping pong or balls thrown to targets like baseball and basketball help attention, bilateral integration, and visual motor skills. Also, depending on the resources, using neurovisual training or the 3D MOT with computer programs help strengthen neuroplastic techniques to restore visual skills that might be lost. Neurovisual training is the picture of the child down here. So he's doing that as a computer program. And finally, video games, depending on the resources available in your clinic, again, you can use iPads or different games like the Wii to incorporate sessions to promote visual motor skills. And you can really create this as a fun environment too, because obviously many kids love video games. So it would be helpful to get clients engaged. And finally, these are my discussion questions. Number one, which type of visual intervention would you feel most confident delivering to a client? Number two, there's a lot of debate over video games harming a child's development, but emerging evidence suggests they can be helpful for visual perception. What do you think about this intervention? And number three, audiovisual programs help visual perception with auditory cues. What other senses would be helpful to improve visual skills in combination with these interventions? Thank you so much for watching.